And lastly, I guess it comes down to Obamacare, which goes into effect officially in January. Just today, I guess, there's reports that the individual mandate is going to be postponed for a year for those people who had policies canceled. That is a very muddled decision, it seems to me. But nevertheless, I think it impacts such a very small amount of people. And obviously the problems with healthcare.gov, I think were overblown. I thought so at the time. But the big story in terms, which I think has not been covered, is the fact that you have at least 7 million, 8 million new people who are getting health insurance because of an expansion to Medicaid. You're having that many denied by state governments who refuse to expand Medicaid.
And thankfully, a bunch of those governors from people like Rick Scott and others are likely to be gone after 2000. We hope.
Knock on wood.
No, I mean they're not looking good. Let's put it that way. Things can change, but Corbett and Scott and a number of them, LePage and Maine are not looking particularly good. So let's hope that we can get some more sane governors and get Medicaid into more states. Because yes, healthcare is expanding, and I think one of the big stories of 2014 will be the success of Obamacare. Because frankly, more people are just going to have healthcare and healthcare they can afford, and it's going to make them happy, no matter what people say on the right and try to remind. Hey, remember a year ago when that website sucked? I've been on the website recently. I get healthcare for my family individually because I've got my own business, and it is so easy at this point to navigate. It's just everything is laid out for you in a way that you never have had anywhere else. Yes, single payer, and it may take a couple of years. Wait till Vermont does it the minute they can in 2017. I guess a lot of states will follow, and who knows how long it'll take them to become national. But for that time being, I think it'll be a positive story, even though it's been a negative one this year. Next year, when people actually have health care, it takes a big load off your mind. So,
Cliffy, again,
Samuel,
thank you so much for being with us on Fridays in 2013. We look forward to you being with us on Fridays in 2014.
I shall.
And then 2015, and then 2016.
Who knows how much longer after? Whenever this show, as long as this show keeps going.